is I can tell you, because I see lots of different people in lots of different businesses, and most of you have met Jim, and our guests have met Jim, and our speakers over the next 2 days, has got it. He's got it together in terms of the energy, the dynamism, the understanding, the willingness to adapt, to change, and to move in that regard. And that sort of leadership is absolutely critical. By putting together this meeting with Todd's help, we have the opportunity for capturing the synergies of each of you coming forward, where your own voice, you say, well, it couldn't be that important. Yet when all of a sudden you have this sort of mixture coming together and the discussions, I've not thought of that. Or yes, this kind of worked in that situation. That sort of dynamism and that sort of synergy comes out of meetings just like this. Who's in the room tonight real quickly? Because Hospice and Compassus and Todd actually looked at it. The range of experience in this room from the surveys, the data you provided, is your experience is from 4 years to 26 years of experience as a healthcare or hospice medical director. The range of specialties in the room tonight is internal medicine, about 29%, family practice, 28%, general practice, 12%, geriatrics, 8%, oncology, 7%. Geographical range, I don't know how many states are represented, but just on our advisory council, we represent Tennessee, we represent California, North Carolina, New York, and the list goes on. All healthcare is local, we know that, and I have had the privilege of delivering healthcare for 20 years, one-on-one, and then going to the United States Senate and working in policy issues where it's kind of healthcare delivering one on a community, and also globally in the work that I do to be able to see the role of delivering health globally. What we're going to do is sort of 4 things in our approach. We are assembling our medical directors, yes, tonight and over the next several days, but we'll do that on a regular basis to capture this rich exchange, this rich texture that comes from this sort of verbal sharing of information, listening to outstanding speakers. Number 2, the advisory council we're going to put together. I'll tell you a little bit more of that. But the idea is to put together thought leaders, of which I am not one, but I'm in the business of giving voice to thought leaders, putting them together in situations that they would not otherwise be together. And then number 3, be able to facilitate regular interaction between the hospice compasses, all of you who are in the field, the medical directors, the people you come in contact with the thought leaders, and get that vertical interaction going back and forth in order to give voice to people on the ground in all sorts of arenas. And the arena might be the intellectual capacity, the data that's out there that thought leaders can give voice to. It might be in policy. It might be, I'll call the President of the United States, say, Mr. President, we're missing something. It's important that we address issues on human capital in the hospice arena, that we direct resources there, or Mitch McConnell or Harry Reid or whoever's in leadership positions at the time. So we're going to have this assembling of medical directors. We get our advisory board, and thirdly, we get the interaction going back and forth. And then number 4, we bring this entire gamut of experience and knowledge and location to solving those big problems that are out there today, the big challenges out there, the insurmountable sort of problems, or so-called insurmountable problems. What do we do? The Assembly, we've taken this mantra of the gift of quality time, and just real quickly, and I'll say something tomorrow morning, the presentations are unbelievable. The schedule that has been laid out, I'm objecting. I had nothing to do with laying it out. And you'll get a little taste in about 5 minutes when David steps up here. You're going to have hospice issues over the next couple of days shared by hospice medical directors, clinicians, doctors to hospice doctors. So it's not just a couple of good talks tagged on to a weekend conference, medical conference on internal medicine, family practice, acute care, chronic care, where you spend all weekend and you get a couple of talks. This is going to be nonstop, top-notch talks. What I can do, because I'm not a hospice doctor and I'm not going to be, I will continue to do what I do in the policy arena and going to Bangladesh and doing surgery, and Africa doing surgery, and Haiti doing surgery. But what I can do is is help with the formation of the advisory committee, which we will do, can help getting the word out, giving voice at a not a larger level, but a more far-reaching layer, just based on my experience of the people that I've had the privilege of interacting with. Let me. This was sort of the quotation that was put in the brochures that you've received, and I really do believe that the way a society chooses to face death and how it honors and cares for its dying are measures of the strength of who we are as a people and as a civilized culture. I am concerned as a country and a society that we have much to do to live up to our traditions of valuing the individual and supporting those who are least able to support themselves, especially at the end of life. And that's the opportunity that I see of us coming together in environments like this where great things can happen. It's kind of interesting when you think about it. Old Jerry Garcia of the Grateful Dead, he has a great quotation or a saying that he said and then wrote, and he said, "Somebody has got to do something. It's just incredibly pathetic. It has to be us." That's the way I feel. You know, why doesn't somebody do something? Well, nobody's going to do something unless it's going to be people just like us. The last thing is the advisory committee. This is fun stuff. And I'm not going to go through each one, but each of these, except for Sean, who was here yesterday, is in the audience now, and everybody will be appropriately introduced. But these are the sort of people you'll be hearing from that are on our end-of-life advisory council, which I call them thought leaders because they're so well known and they spend so much time in the field that all of you are dealing in. So I'm very excited about working with them over the coming years. Tomorrow, Saturday, we got fantastic presentations. We got the skills workshops. We then on Saturday morning will have all of you get together and say, okay, that was good, that was fun, I learned this stuff. What we're going to do next is, and there'll be a survey that Todd will get out to you of what would you like to see happen in 4 to 5 months or 6 months, or Jim, whenever you let us get back together again, or whenever it is. And so you will set the agenda of what you're interested in and what we can do, including the advisory council, to best help you fulfill what your dreams are or the next thing that you want to do. All right. No, Sylvester, don't say how bad I've been. David Kessler. David, thank you for being here. David and I have not met, but I can tell you that there is no more respected, and all of you know it, so I feel kind of funny introducing him, but there is no more respected voice or more frequently heard voice in the field that all of you spend your lives in. Whether use of his writing, in the 3 books that are here, whether it's the internet, whether it is using social media, whether it is using traditional media, whether it is through video footage, whether it is through his work with Oprah in reaching people about this end of life, bringing peace, the dignity of death and dignity of the use of time approaching death. His best-selling books out there, his lecture series, in fact, he's here tonight, the fact that he'll be with all of you tomorrow means that he is able to reach hundreds of thousands, millions of people with a message that can be heard, and if it is heard, will bring more fulfilling life to each of those recipients, each to those listeners and their families. Everybody knows of his history with working very closely alongside with Elizabeth Kubler-Ross for the last 10, 12 years of her life, co-authoring 2 books with her on grief and grieving, finding meaning through the 5 stages of her life lessons. I don't know if I have that up here yet. I do. Here. On grief and grieving, I guess it was completed just a month before her death, is Kubler-Ross's final legacy, and brings her life work profoundly into a full circle. And in all of these books, The Needs of the Dying, On Grief and Grieving, I use these kind of as props, but also to demonstrate the efficacy of that voice in reaching so many people around this world. David, it's a real pleasure and a real honor for me, who is fairly new to the formal field of hospice, of palliative medicine and dying, to introduce the preeminent person in the world today. A real privilege for all of you, but especially for me. Join me in welcoming Mr. David Kessler. David, come on up. Thank you. Yeah, great.
Thank you so much. It's a real pleasure to be with you. And Jim, thank you for the invitation. Todd, thank you for organizing this. And Senator, Doctor, I'm just amazed the way heart-lung transplant kind of rolls off his tongue as if it's, you know, taking tonsils out. I'm still going, heart, lung, really? It's just unbelievably impressive, and I'm just honored to be here with you tonight and everyone. I want to talk about the work we do, and I am thrilled. Believe it or not, I don't get lots of opportunities to talk to such a pure hospice audience. Many times I have someone unlike Todd calling me saying, we'd love you to talk and kind of be motivational and uplifting and talk about the meaning of life, but don't mention death or end of life or anything like that. Keep it peppy and upbeat and fun. So I will still do that, but it's just wonderful to be here with you tonight. So just a little bit about my background besides what was mentioned. I'm now in hospital administration. That's actually me years ago, believe it or not. With a young child at Children's Hospital that I worked with. I oversee about 8 or 9 departments now in the 5th largest system in Los Angeles, healthcare system, with 3 hospitals and a freestanding hospice and home health. I oversee pastoral care, which is interesting. When I started working and overseeing pastoral care, our priests and chaplains made it very clear that they report to God. I just sign their time cards. And I oversee our palliative care, case management, social work, discharge planning, language resource, our interpreters, our ethics committee, patient rights, hospice, home health, the volunteers, our emergency room, hospitalists, physicians who are on call. All of these people, you know, it was interesting when the CEO kind of asked me to take these departments on. I thought they all deal so much with end of life in so many ways that it really made sense. My new book's Visions, Trips, and Crowded Rooms that I just finished that's out, and I'm very proud of it. It talks a bit about deathbed visions, which is something that physicians and social workers and nurses in end-of-life care have realized patients have dealt with, and I wanted to bring just some awareness to that subject because I thought it was important. I also work with the LAPD as a specialist reserve dealing with end-of-life care when officers are killed in the line of duty, and with the Red Cross on their aviation disaster services. I think the last 2 are really interesting for me because many times when you work in end of life, you can begin to think it's very predictable how it occurs, and it's good to realize that for our patients and clients and families, it's a traumatic event that many times comes out of nowhere for them. This is one of the reasons why we have to keep doing this. I don't know if you saw this in the headlines. Let me just read it to you. The world death rate is holding steady. In Geneva, Switzerland, it came out that the World Health Care Organization's officials expressed disappointment at Monday's meeting at the group's findings that despite the enormous efforts of doctors, nurses, and rescue workers worldwide, the death rate still remains at 100%. For those of you who are more visual learners, here it is graphed out. You can see that our job, we're going to continue to be needed, and it's going to be, this is actually from The Onion, which is a newspaper that I grab always at the college's campuses near my home. But I thought, you know, this is an issue that we are going to be dealing with, and people often don't like to look at it, and yet we do need to deal with it. I want to give